Hello everyone. Today's topic is communication in a Morth. We all know that there are like four communication stations in a Morth Part B Edinburgh, and there are two communication stations in ASIA's England exam in a Morth. So communication is very important, and especially most of the candidates, especially the Asian candidates, they fail in the communication these days, especially in Edinburgh, because they do not know the basics of this communication, like but how to cover a communication station. So that's why I decided to make this presentation. So I will share my screen. So I made a small flow chart for this communication station. So when it comes to communication, I divide communication into two parts. One is the subjective part, and that that cannot be manipulated a lot, and two are the objective parts. So the start of communication and the end of communication, it's objective part. And it means that but you can prepare these things at home and give pinpoint, but you can speak in a very fluent way in the exam and give a standard answer for those things, or you can do a standard speaking for those things. While for the subjective part, which is in the middle, it's the patient who is taking the charge, and it depends from patient to patient, like what the question they ask. So there's later room and that one can teach you a lot there, because it depends your knowledge. It depends but how you have been previously trained, and whether you have treated such a specific case or not. Or sometimes the questions are related to NHS, and those questions, obviously, if you worked in NHS or you have that knowledge, that those things depends there. So going for the objective parts, because in this presentation, I will tell you that how to tackle the objective part and gain half of the numbers, which are very easy numbers to gain. And most of the candidates especially fail here because we all are orthodontists, and when we sit in these exams, we do not miss uh, like what uh, what the basic information, because these are the basic information we are dealing every day, and we provide those basic information, the technical information, but the start and the end is actually poor. So from the start, what in a Morth exam, especially in Edinburgh, they are now having these cabins where the actor is placed. Previously, it was not the situation, but now in most of the exam this year in 2023, they have these cabins. So your time starts and you enter the cabin. So when you enter the cabin, the best thing is you greet the patient saying hello, then you take the chair, and then you start your communication by saying some greeting again, like what good morning, and then with your name, right? So I always ask the candidates that it should be like one of my candidate, Mustafa, then he used to say that it seems like you have obsessive compulsive disorder. So you should repeat the same lines again and again, right? So in all the communications, and this should be on your fingertips. You enter, you said but hello, then you got your chair, you said good morning, and then hello, I'm Dr. Whatsoever the name, but I would say like this, hello, or I would start from good morning, I'm Dr. Harris, and I'm the orthodontist at this practice. Some people see it in a different way. My point is that it should be standardized. Every time you should say the same. So you shouldn't make mistakes under exam stress. Some people say like this, hello, I'm Dr. Harris, and I'm your orthodontist for today. Is it fine with you? So others say like this, that hello, I'm Dr. Harris, and I'm the orthodontist at this practice. Then it's very good practice that you ask the patient his name or her name. So may I know your good name? The patient responds, but he or she tells you the name. And sometimes they tell the complete name. In that case, many a time the doctors say that if you don't mind, someone's say that my name is Haris Khan. So and the orthodontist or the candidate should say that, um, if you don't mind, can I call you Mr. Khan or Khan, right? So only one word. So move to the next line, and that is, may I know why you have visited me today, right? So one thing I failed to mention initially, this scenario is basically for the patient coming the first time. So in Edinburgh, most of the time, like within half of the cases, the patient is coming the first time. In other scenarios, the patient is coming second time, and it's mentioned there in the communication before you enter in the examination hall. Like, but for communication station in Edinburgh, you have 5 minutes before the communication actually starts, and they give you all the scenario. While when it comes to England, you have 10 minutes, and in those 10 minutes, you have to read that scenario and you have to decide for the subjective part, which is the middle part, and the initial and the end should be on your fingertips. So as it's the first time, you don't know what's the problem, like what you have to behave, you don't know what is the problem because it's the first time. So some people make a mistake here, and like but at this point, and they say that, uh, before we move ahead, I want to confirm that you do not have any specific medical problem or there's no change in your contact information. The patient is coming the first time, right? So you are not supposed to ask these questions. And sometime after getting the answers, no, I do not have any specific problem, then like what they ask, may I know why you have visited me today? And the patient mentioned his concerns. Sometimes he tells you that he visited for his child, right? So when he's visited for your child, your question is irrelevant, asking the medical problems of the patient, like for the person who is visiting you. So it's a better practice that you ask these questions after you have answered the concerns of the patient. So the patient mentioned the concerns. Suppose it's a thumb sucking habit. In that case, the patient mentioned the concern. And then, like what you tell the patient, like, but I do understand your concern. That is called empathy. Always show empathy. It carries a mark in the exam. And then, like, what answer the patient. And then, like, what once you have answered the patient, you ask this question to the patient that if the patient came for his or her child, you ask this question to the patient that whether this child has any specific medical problem which they want to share, right? So at that point, I think that thing should be asked. So show empathy because it's quite important that you show it. It carries some marks. Um, Ask patient the relative history and then encourage the patient to ask the questions during the sessions, right? So you can encourage the patient during your communication that like, but it's a very good question. And I believe that every parent should know this, or every patient who is going for orthokinetic surgery should know this, like but whatever the scenario is there. So encourage the patient. And sometime, like what you have to ensure that the patient is understanding it. So at least once show empathy, at least once encourage the patient, and at least once like what take the patient on board that he's understanding what you are saying. Just say like what I'm seeing, it makes sense, right? Do you get what is involved in this procedure? And so I would say that till this point, as a patient, till this point, yes. So this is objective part. And then like what at the end, this is objective part. In the middle, like what you need to give some technical information, but some things, some points like what empathy, like what encouraging the patient to ask a question, like what taking the patient on board, like what he's understanding your answers. That is a subjective because you have to provide some technical information and the basic like what information from there. Always use a layman language, right? Do not use orthodontic terms. So the end is also subjective. Like what once you think like what you answer all the questions and patient has no further questions, or the patient tells you that he or she has no further questions. So you have to end the communication on some like what on a standard notes. Like what do you have any further questions? The patient would say no. So the doctor would say that if you have any further questions, you can like but always call us, or you can write it down and bring it to your next appointment. It's quite important that you understand everything that is involved in the treatment of your child for this problem in the orthognathic surgery, whatever the communication station was, before you decided to go ahead with treatment. And then, like what you can give something in paper, like what they provide you A4 size paper to write your notes. So you can make this paper as a roll, or like what just bend it, and you can say that this is a patient information leaflet, and this is related to your specific problem. Just mention the problem there, and it also got our contact information. And I hope these would be useful. And do contact us if you have any further question. Then, like what just ended, the patient would say, "Okay, thank you." You would say, "Thank you," in that sense. Sometimes you simply like what give it to the patient. This like what your A4 sheet, the information leaflet, right? The patient will take it and place it on the table because he's the actor, you know. So one thing, especially for the Arab candidates, or for the candidates, I won't say Arab, for the candidates who think like what they have a strong accent of their native language, and the actor is not understanding it. So if any point you believe that the actor is not understanding what you're saying, because they also, like what RCS in Damra did a webinar, and they also mentioned in that webinar that if at any point you have this feeling, the patient is asking the same thing and not understanding it, your accent, right? You can tell the patient that like English is not my native language, and if you have like what any problem understanding me, you can always ask me, and I will try to speak slow, try to speak more clear, right? So we do not have a communication gap. So this was a patient coming the first time. So sometime they mentioned the patient is coming the second time. In that case, things remain almost the same. Only when you enter, you can greet the patient by his name, or if you skip the name, you can say that, "Okay, nice to see you again. My apologies." Like, but if you want to ask the name, my like, but you can take it like this: "My apologies, but I'm sorry, just your name just skipped from my mind." So the patient will tell the name, go with the name, right? Been and say that I went through your records, or before, in fact, like we're going for this, when the patient is coming the second time, you can say that, okay, like what the patient name is Haris, you can say, okay, or Mr. Khan, you can say, okay, Mr. Khan, before we go ahead, I just want to confirm there's no change in your medical history and your contact uh, information, right? Then start it as the first time and end it as the first time, right? So that's the difference for the patient coming the first time and the second time, because in the second time, the initial part, which I used to call the objective part, which you have to prepare it from home, is slightly different, right? You have to ask the medical history, the change in contact information from the start. You can call the patient from the start. You have to communicate the patient in a different way from the start, like, but hello, I'm Dr. As you know that I'm Dr. Haris, and nice to see you again, Mr. Khan. So things like that. I hope like it would be useful. So thanks a lot for watching. So if you have any questions, you can write it in the chat, right? And I would be glad to answer them.